Welcome everyone to the Man in Search of Gold podcast. I'm your host, Eric Mangold, and I'm the founder of Advocacy Wealth Management. This is the show where we share ideas, strategies, and history to help you improve your life one financial move at a time. Let's get started.
And we are back, Man in Search of Gold podcast, and we are rolling. I am very pleased to have Dr. Michael Suck as a board-certified orthopedic surgeon. He's our guest today. So board-certified orthopedic surgeon, healthcare leader, former chair of the American Medical Association Board of Trustees. Throughout his career, Dr. Suck has held several influential leadership roles, including serving on the AMA Board of Trustees, the AMA Political Action Committee, and currently as chair of the Joint Commission Board of Commissioners. He also spent over a decade at Geisinger Health System as a chair of Department of Orthopaedic Surgery and chief physician officer, where he led large-scale clinical and operational initiatives. An innovator in healthcare, he introduced the concept of a lifetime warranty for joint replacement. I think I'm really interested in hearing more about this because a lot of my friends are getting in that age where people are getting joints replaced, a lifetime warranty for joint replacement, and has been actively advancing digital health, AI-driven care models, and value-based healthcare systems. His work focuses on improving physician engagement, clinical workflows, and sustainable care delivery. Dr. Suck brings a unique multidisciplinary perspective with degrees in medicine, law, public health, and business, and has been recognized as a White House Fellow under President George W. Bush. His insights span clinical care, healthcare policy, leadership, and innovation. Thank you so much for being here.
Thanks, Eric. It's good to be with you. It's good to have the opportunity to share some thoughts.
I welcome it. And I think there's a lot of places that we can go here. So first, I always like to hear what started it all off, your path, your journey to medicine. Was it, you were a kid and everybody was playing with Legos and you had the stethoscope around your neck, or, was it further on down the road? What was the first step, or were you the first thought for your journey to medicine?
Well, I'll share with you, Eric, that I am very fortunate in the sense that I come from a family of physicians. And so I'm actually a third generation orthopedic surgeon. And the reason I start with that is because even despite that, I fought very hard not to become one. And so my father, my grandfather, both orthopedic surgeons, and I grew up around it. I was always very intrigued, by musculoskeletal health, having been an avid athlete, playing tennis, playing a number of, all sorts of sports, getting injured, et cetera, et cetera. But when I found myself going into college, I actually fell in love with the field of history, and I wanted to become a history major. I went to Carleton College, liberal arts college in Minnesota, and really, I think for myself, found a real home to explore lots of different things and be engaged in lots of cross-disciplinary activities. And so I was convinced that I was going to go teach history for the rest of my life after college. I did go through as a pre-med. And then when I finally got toward my senior year, my father asked me a question. He says, "How's your medical school applications going?" And I told him I hadn't applied. And I told him that I was planning to teach history in high school, and I had a number of opportunities and was going to go pursue that. That notwithstanding, I ended up applying as a favor. I ended up getting in, ended up trying it and doing what I needed to do, and then really found I think myself immersed in the questions around medicine, but also bringing, I think, a different perspective, the humanistic side, which kept me in it, and I think keeps me in it today. That's what I think fostered and spurred the pursuit of a number of different adjacent degrees. So during medical school, I was fortunate enough to enroll in law school at the same time.
Wow.
And during law school, I was able to engage in the Masters of Public Health programs. 2 different cities, 2 different dean negotiations, 2 different worlds really at a time almost nearly 25 years ago where, online education wasn't there. So it was a lot of work, a lot of travel. But for me, a really, really important step toward engaging in the world of medicine outside of just the procedures that we're doing. And, specific to my chosen field, of all the aspects of medicine, which I did love, I really fell in love with orthopedics. And I can't tell you, it might be genetic because of my history, as I've told you, but loved orthopedics for a couple of different reasons. One is, I love the architectural components and
Mhm.
the artistic components of putting fractures and dealing with very difficult problems, which is why my subspecialty is orthopedic trauma. And I still love the engagement with patients to take the injured and make them healthy, or at
Mhm.
least take the ones who can't walk and make them walk. I love the gratification that you get from seeing the results of working with your hands. And I think some of the more abstract world of medicine, I think I take care of on the more right side of my brain. And that's where I get into policy and I get really excited about advocacy and a real driving for, imperative to help make physicians be better for themselves. A lot like what you do, Eric, in terms of helping physicians find their best self and giving them the tools to succeed. And so I really thrive and enjoy being in that space.
So when you're undergrad, so then you're taking your medical exams, right? So is that where orthopedics kind of right? Med school was where you got the taste of orthopedics, or is it soon after?
Well, med school was pretty broad based,
Mm,
but I think, spent my life getting up to medical school and being exposed to orthopedics. I have great respect for my father, my grandfather. I always saw the work that they did. I was always amazed at the people that would stop them on the street and thank them for the work that they
that's
did. So I had
awesome.
that type of influence.
Yeah.
And also being an athlete, I think also doesn't hurt because I experienced a number of orthopedic injuries and really felt the kinship toward their consistent mentality to get people back into a quality of life,
Yeah.
and that's really affected me.
Yeah. Then where did you do med school?
So I went to medical school at the University of Illinois,
Okay.
and then I went to law school at Boston University, and also did my MPH there.
Okay. Got it. And then where was your first, I guess, residency?
So I did my residency after medical school at Montefiore Medical Center
Hmm.
and Jacobi Medical Center in the Bronx, New York.
Hmm.
Affiliated with Albert Einstein School of Medicine. And then following, I did a fellowship in orthopedic trauma at the Hospital for Special Surgery in New York City.
Got it. Okay. So we talk about orthopedic injuries. So I had my ankle done there.
Okay.
And then my dad had his back done there. Let's see, Dr. Camisa did my dad's back, and
Yeah.
Dr. Deland did my ankle.
No, both are excellent surgeons. I worked with had contact with both of them while I was there as well.
Oh wow, my ankle. I mean, it's kind of a boring story, but I would always run, and I would run at night because it was cooler and it was easier to kind of end up, not a lot of people on the road, not a lot of cars on the roads, but you know, sometimes you step in potholes when it's dark, and so I sprained my ankle more times than I can remember, and to the point where it had just the ligaments were all messed up. I had all these bone spurs, and I had one surgery in Philly, and it didn't really do a whole lot. And then when I went to see Dr. Deland, and it was like it was game changing. He was like, "Well, this is wrong. This is wrong. This is wrong." He's like, "These are." He goes, "You can live with this." But I said, "Yeah, I can." He goes, "But you're not going to be able to run or play hockey or snowboard." And these things I enjoy, and I was like, "Well, I want to be able." At the time I was in my 20s. I'm like, "Yeah, I want to be able to do these things. I'm an active person." And yeah, I mean, it's been 26 years since he fully went into my ankle. Never looked back.
Yeah, I'm very fortunate to have had really great exposure to great surgeons and mentors along the way. Really great experiences. The my residency training was very trauma heavy,
Mm,
and so lots of exposure, lots of cases. Special surgery, very academic and really thoughtful in terms of its thought leadership, which is why it's the number one orthopedic hospital in the world.
yeah. I was thinking about something too. We mentioned about how people would come up to your granddad and your dad about,
Yeah.
thanking them. Because and I know physicians especially, they get pinged in so many different directions from, I mean, even for people like me, financial advisors or pharma
Mhm.
reps or, people looking to may have them invest or just so many different directions. It's one of those things where I kicked an email over to Dr. Land probably 2 or 3 times over the course of the last 20 years and just said, "Hey, by the
Mhm.
way, I don't know if you remember me because you do hundreds, if not thousands of these procedures or operations, but thank you so much because I never looked back after I saw when he discharged me, he said, hope we never see each other again. I said, yeah, I agree, right? But it was the type of thing where it's almost like I would venture to guess there's almost should be some kind of forum where you could like thank a physician, like where they can actually see because I'm sure maybe his assistant or maybe like a nurse practitioner saw his message. Like it's like, I don't know if the message ever I don't know if my message of gratitude ever got to the doctor.
Mm.
It's almost like there should be some kind of forum for that.
It's interesting. I would be surprised if it didn't get to him. I think that
Okay. That makes you
You know,
feel better then.
as a physician, I would tell you those are some of the most gratifying things we hear.
Yeah.
You know, our world is full of I think obligation, duty, work, and sometimes less gratification. And I think the best things that happen in our day are when you have patients who are doing well, and patients who take the time to thank you. And I think about it like this, Eric. You know, all of us have experienced at some point in time, you know, a disappointment or a bad experience. You know, think about an airline, right? And you know, but honestly speaking, how many times do we each of us actually spend the time to write a letter? It takes a lot, right? And so I think for someone on just the opposite side to turn around and write a note to say thanks, I recognize, and I think most people recognize that that's a really big deal. That's more than just an afterthought. So
Yeah.
it's great that you did that. And I'm glad that you had a great experience. I'm sure Dr. Deland truly, you know, appreciated that note because it's an acknowledgement. Most of us just live in the middle, right? It's like, yeah, I
Yeah.
did fine, whatever, you know. But it takes a lot of extra effort to spend the time. And you know, I'm fortunate to have received a number of those over my career, and you know, people still find me on social media 30 years later, and like, hey, man, I'm still doing X, Y, and Z, etc. And it's really nice to hear.
Yeah. Yeah. And that's the thing. It's like, it's also, you don't, we're everybody's busy, right? But I don't like using that as an excuse not to show gratitude. You know,
Yeah.
it's also in doing the right thing. I mean, you know, it's taking that extra step. I mean, listen, I mean, if he could have said, listen, I can't help you. And that was after I went to probably 5 or 6 different ankle specialists. And he gave me my active life back. I mean, that's not a little
Yeah.
thing. So
Yeah, that's it's a special place. You know, I have prided myself to also be in that category as a last resort
yeah,
type of surgeon. And to some degree, there's some risk associated with that. But I think that it all starts with the patient relationship. I mean, you know, being upfront, being honest about what's possible, what's not possible, and
yeah,
what are the potential outcomes. And you know, I think you know, I for one, and I'm sure others, many others do. I like to believe in the positive end of things.
yeah,
So if
hundred
someone
percent.
says there's a 2% risk of infection, I like to say, well, that's a 98% chance of success versus saying I won't do it because of that.
Yeah. Now, this is a question that fascinates me. I don't know if it's how interesting it is for you, but I'm always fascinated because when you first see, and I know you work in med school with cadavers and everything, but when you're in trauma orthopedics, I mean,
Yeah,
so imagine car wrecks, you know, a lot of falls, wacky things. I'm sure you have a lot of stories.
sure.
Were there times you're just like, this is grotesque? Like oh man, like do you find, is it exhilarating? Do you find, is it sometimes just hard to stomach? Like, what are your feelings when you see some of these injuries that you're helping to heal?
Well, listen, I'll tell you that those of us who are in the world of orthopedic trauma, I think, see things that most people see as, you know, as you've described, grotesque or really at the extreme ends of things that we would want to see. And I think most of us who do orthopedic trauma see it as opportunity
Hmm.
because where we intervene in bad traumatic injury is from the standpoint of saying you're starting in a bad place, but I'm going to make you better.
Yeah.
Right. So there's no sense that opportunity to make somebody better doesn't necessarily always mean putting things back together, et cetera, et cetera. It could mean that you lose your limb because that's better for you in the bigger picture.
Hmm.
But every time, every orthopedic trauma surgeon that I know sees injury and accident not as the end of the road, but as the start of a new one. And what that is in my mind, and the way I describe it, is opportunity. It's an opportunity to help. And those are, I think, those are the characteristics that make maybe most orthopedic surgeons, but certainly in the specific world of ortho trauma, you know, these are some of the most optimistic people that you'll see in medicine.
I guess you have to be, right? I guess that's part of that certainly would seem like it's, if that's in your DNA, that would be helpful.
Yeah. Yeah, I think that it's what attracts us to it.
Hmm.
It's, you know, there's a very mechanical type of, you know, fixation mentality. You like to put screws in bone, you like to put plates on bones and things like that. But the artistic, I think architectural side is that it's one thing to just put metal in, it's another to do it thoughtfully
Hmm.
and to do it friendly to their biology and to do it in a way that makes real biomechanical and architectural sense.
Hmm.
And so it speaks to the fact that, you know, even in college, you know, if I'd have picked a different career path other than history, I was very inclined to become an architect.
Hmm.
And I find a lot of similarities and overlap with the work I do in ortho trauma.
That makes sense. That would seem like this. No, it makes sense.
Yeah.
Definitely. So
Yeah.
then how long were you, are you still on the operating room or are you more on the,
Yeah.
okay.
Yeah, I mean, I do a lot of administrative work, but I've taken a little bit of a break over the last several 9 months or so.
Mm.
But the full intention to go back and do continued specialty work in orthopedics.
Okay, gotcha. So when you go into orthopedics and you go into trauma orthopedics, do you is it specialized? Do you focus on the lower extremities like hips, knees, ankles, or is it, you're a trauma orthopedic, you might get a shoulder one day, you might get an ankle the next day, you might get a neck the next day. You have to be a little bit of a jack of all trades?
Yeah, most orthopedic surgeons are, by far the majority, are what we call appendicular surgeons and not axial. So that's not the spine.
Okay.
And so we do the extremities, and orthotraumatologists tend to be facile around all areas around all extremities. Now, eventually you may start to like things better or, a little bit more specialized. So
Hmm.
some people like to do the lower extremity mainly. In general, as an orthopedic trauma surgeon, you're looking for all things that are related to injury, a fracture. And that includes the acute fractures and the ones that get infected and the ones don't heal right and the ones that heal crooked. There's also a subspecialty within the area of the pelvis and acetabulum, which is, a key area of ultimate morbidity and injury.
Hmm.
But there's some who like to do that more than others. But in general, orthopedic trauma surgeons work all around the body except for the spine.
Interesting. So how does it work when you're dealing with trauma and somebody might have multiple traumas? And how do you interface? How do you build your team? Do you build your team? Does the facility build your team? Is it a collaboration? Like, how do you build your team? Because I imagine you have trauma injuries. Time is of the essence.
Yeah.
You need a solid crew with you. You need a solid team. It's and instead of people saying, "Well, we got to do this or we got to do this," it's got to be more of a flow versus a conflict, right? How do you build that team?
Well, it's interesting. It's, trauma orthopedics is, as you are rightly pointing out, a team sport, and that includes things outside of just your orthopedic environment.
Hmm.
So typically on an activation and a bad accident, we're not the first ones on the scene. And the reason is because you have life before limb during an injury.
Mhm.
And so your trauma team, the general surgical trauma team, will assess the brain, the spine, the abdomen, the pelvis, the lungs and the heart, all of which I think are critical first steps to ensure the next version. And once all those things are stabilized, that's when the mobility surgeons, the ones who are here to restore limb and length, are involved. And so we participate in triaging, the types of injuries, but also regulate our space within the time frame of the entire episode.
Mm.
And so we're not first ones on the scene all the time,
Mhm.
although we're there to help with specific injuries that need to be dealt with immediately for dislocated joints or open fractures and things like that. But at the same time, and I think this is the beauty of what we do, is we can stage our approach to the limbs once the life is stabilized.
Gotcha. Okay. Okay. But again, that requires the teamwork. Like it's got to make sure that that everybody's kind of not necessarily everybody's in agreement and everybody's a yes man, but it's also you need that kind of common goal of okay, there's certain things you need to take priority on.
Yeah, that's exactly right. And I think those are pretty algorithmic thankfully to this point, is
Mm.
that over decades of research of understanding the time and the necessary of the golden hour, et cetera, over time, we have enough body of evidence to have really strong protocols in place for all of
Mm.
these things. Um, it's not perfect, right? And the cadence and the dance has to be done very well. And it's done usually best in a level one or a level two trauma center.
Hmm.
But once it works, if it works out well, patients' lives can be saved and their mobility can be restored. And you can take patients from the worst possible day of their life and head them toward a better part.
Yeah, I think that's a really interesting way of putting it too. For anybody that's spent any time in the emergency room,
Yeah.
I've unfortunately seen the inside of an emergency room a few times, right? And it's, that's a good way of putting it. Talk to me about what you talk about with the lifetime warranty on joint
Sure.
replacement. When I saw that as part of your biography, I'm like, okay, this is something I definitely want to hear more about.
Yeah, I'll share with you. So when at the Geisinger, I was the chair of the Musculoskeletal Institute and the orthopedic department and professor for over 15 years, and only recently left to pursue some other opportunities. But while we were there, Geisinger is a unique system in that it's an integrated environment where you have the clinic, the physicians, and the hospital and the insurance plan all working together.
Hmm.
A little bit different than the Kaiser model in that that our insurance plan wasn't the only insurance plan that we took, but it was one among many. That type of arrangement allows you to do experimentation, if you will, of finance kind of allocation. So typically, if someone's doing a surgery, then the insurance company pays. So physicians in the hospital make money and insurance companies spend money. But when you're integrated, it's really a left pocket, right pocket type of transfer,
Hmm.
right? In that, if it's all going into one pot, and how do you take a balance or take an opportunity to experiment within that environment to decrease the amount of spend, but increase the quality of the surgery you're doing, and then tie them together. So at Geisinger, we started a program called Proven Care back in 2011. And what that was is we were, before any bundles or anything had ever come out, we were the first in the country to say we're going to provide a 90-day warranty for cardiac vessel, single vessel heart care, because we knew our outcomes. We knew that the inputs going into a good outcome were readily controllable by our environment. And so we were the first to create a 90-day warranty around it.
Does
I
that
arrived in 2012 and started to look at not only the cardiac care, but I, really wanted to build it the same warranty around total joints and different aspects before, again, the government started doing bundles. In fact, they modeled much of what they do after what we had built. But then I couldn't stop at just saying, okay, we're done. So I started to ask the questions. I said, if we're that good at what we do, why are we stopping at 90 days? Why not make it a year? Why not make it 2 years? And then why not make it a lifetime? And I just got laughed out of the room. It was like, you are out of your freaking mind. And for me, as you people who know me, I think you tell me that I'm out of my mind, it gets me more motivated to show you I'm not out of my mind. It was the same conversation I had with people about going to law school and during medical school. You're out of your mind. You can't do it. That's not possible. And I think taking that same mentality was not just to be doing something in spite, but really it was fundamentally based on this question. If you're that good, how far can you stand behind it? Right? And so, you think about the current world we live in terms of how we finance healthcare. And this is the funny stuff, is if you go get your muffler changed by a muffler company and on the way home it falls off, the back of the underside of your car. Well, you go back and you say, fix this, right?
And they do.
And they usually fix it. They say, I'm sorry, I'll fix it.
Yeah.
In healthcare, if you leave the hospital and something goes wrong, you go back and what do they say? You pay full price.
Yeah.
That's the thought process behind why would that happen and why does that matter? So when we extended into a lifetime, we essentially said, how can we do this? Right. And if you think about it from a very practical standpoint, in order to do anything where there's a lifetime, you've got to know you're in control of all of the things that could potentially be a problem. And for us, it was, do you have the right surgeon? Do you have the right implant? Do you have the right patient? Do you have the right conditions? Do they live at home alone? All these types of things that need to be put into the mix. And then if you conclude that at some point you can get comfortable enough that you've controlled all of those things, then you can almost predict what the outcome is going to be. Now, that's great for the short term, but how do you extend it to a lifetime? Well, at the same time, as long as they're insured by our insurance plan, right? If they go through and something happens to them after they leave the hospital, normally they'd have to pay full price, but they're under our insurance plan. And I described to you the integrated system. So in this case, they stay in our insurance plan and they keep the guarantee and we provide the care anyway. So in doing so, we can keep it all under one loop.
So let's take it where we talk about someone that has some type of surgery that requires hardware or, medical device. And so then basically is the Geisinger system in that case, like eating the cost of that hardware if that person needs to
Great
get
question.
if you're doing their hip replacement and the hip, for whatever reason, hardware doesn't work, is then Geisinger saying, okay, for the next hip, we're absorbing that cost.
Yes and no. And that's such an insightful question, Eric, because the hidden secret that most people don't even ask me about with regard to the warranty is we didn't just do it internally. We brought in an implant partner. And the implant partner, called Medacta, doesn't necessarily just say, I'll give you a free implant, but they went at risk for the clinical care as well. And that's the part that almost nobody talks about. So when a patient comes in under the warranty, if something goes wrong, right, they have no out-of-pocket expenses for the rest of their life. And that means also that whatever the cost of the care after the index surgery, Medacta, the company, is on the hook for a portion of the clinical care, not just the implant.
Wow.
Which is amazing. And that's never been done. And that still hasn't been done.
It's one of the things too, where you talk about, back, 15, 20 years when we talked about car manufacturing and then
Yeah.
how, and even today with certain appliances, like they talk about like washer and dryers, that people with it, like my mom's got her washer and dryer that's been there for 35 years, but most new
Yeah.
washer and dryers won't last 10. And it's one
Yeah.
of those things where it's like, okay, the quality and the care and the production of these pieces of hardware the quality is just better. The fact that they're
Yeah.
now lasting, instead of saying, okay, we want something that's gonna, expire or you have to be redone in 10 years, 12 years.
Yeah. Yeah, I think that implants have gotten better for sure. This bridge across the folks who are actually doing the surgery and the implant supply or the manufacturer supplying the implant has not been bridged before. And the
Hmm.
way we created a comfort level is that the company played an important role in making sure that training was in place, that they were in true partnership with us so they could help understand who are the people in the room, how are you doing the surgery, what are the clinical components of it, so that we in partnership were able to do something that we all felt very comfortable with. Yeah.
We probably could go off on a massive tangent and talk about healthcare in the country,
Yeah.
but
I'm happy to do
is
it.
i- is is that a model that you think that could be launched broad scale, countrywide, impact everyone? Because I hear it all the time. Physicians, they're making less, they're working more, their expenses are going up, and insurance companies are making the lion's share of the profits.
Yeah.
And my wife's an occupational therapist, and she runs a rehab department in a subacute assisted living facility. And she tells me all the time about how hospitals need to discharge patients to the nursing home, but they don't want to get them back within 30 days or else Medicare doesn't pay. And it's like, I'm like, these policies all sound like lunacy. Here you have a policy of telling somebody, listen, if we perform something for you, we're going to take care of you for life. Like, that sounds unbelievably beneficial to the patient, but it also doesn't sound like it leaves the insurance company or the facility or the physician out in the cold, right? Like, is that something you think this could be rolled out more?
So, when I started this whole process, the whole idea was that it would become a model, but there's a lot of resistance, as you can imagine. And I want to be very clear too that it's not available for everybody. At a certain point, there are certain risk factors that you cannot dismiss.
Sure.
But the patient has to be the right patient. They have to be motivated in order to qualify for warranty. So if you take a BMI of 45 and she happens to be a smoker and a diabetic, there's no way you're going to guarantee that thing for life,
Sure. It's almost like
right?
you have to
So
underwrite it.
right, but the key component is that by you could potentially, if they're able to reverse certain things. So you're actually encouraging patients to get into a better potential situation so they can qualify. It's not a disqualifier for life. It's just a motivator to say if this is something that you're interested in, this could potentially get you into that right place.
I love that
We can
even more
provide
because,
the
like,
nurse
okay,
program.
so I remember going back. My mom's 83, and about 5 years ago, she had her knee done, and
Mhm.
she's 83. She's in pretty good shape for an 83-year-old lady. Like,
Sure.
she walks every day with her friend, and she stays active. But when it was wear and tear, when she needed her knee done, the doctor said to her, he goes, "Listen," he goes, "You're active, you're eating well, you're taking care of yourself." He's like, I'm going to take care of your knee. He goes, the people that I won't do are the people that are massively overweight, that won't change their habits. That
Right.
he goes, I might replace their knee, but if they're really overweight and not going to change their habits, I'm going to see them again in 4 or 5 years and to do their knee again. He goes, I don't, and he said that's not helping them.
Yeah, and I think I would extend that even further, though. It's recognizing the risk factors and doing surgery is just a small sliver of the total episode of care.
Mm,
And I think that the things that are really important to recognize is that most people in those situations who make surgical decisions don't have the tools to say, "I won't do your surgery, but I'm going to put you in this program
yeah.
to get you better." Instead, there's a lot of, this speaks to the segmentation of the healthcare marketplace, is that patients get shuttled all over the place.
Yep.
If I'm not going to do your surgery, I say, go find somebody to help you stop smoking. I don't say, here's my stop smoking clinic, right?
Right.
And again, those things are not necessarily easy to structure, but you can imagine in a future state that patient care would be delivered very differently if you had an opportunity to integrate them and all of their needs in one place,
That would be,
right?
I think
Right. And so what I'll tell you is that, I see this firsthand because as a surgeon of what, some would say last resort, the one who's willing to talk to patients who have been to 5 or 6 other surgeons. That's what I see all the time. I've seen this person, they said they can't help me. And then I said, then what did they say after that? They said, good luck. There isn't a process that we're really very good at today that says, here, let me help you move to the next step. As chair of the Musculoskeletal Institute at Geisinger, I instituted kind of a concept and a rule for our surgeons in that you have to think about a patient's need as a football, right? And you have to be able to pass the football to the next person. So it's not good enough to say, I'm not your guy or gal. It's, I'm not your guy or gal, but here's who I think might be. And I think we're missing a lot of that sensibility, I think, in our healthcare system today, which I think makes patients very upset, feel helpless and powerless in a very, very complex, oftentimes complex situation.
I mean, personal experience, going back to my experience with Dr. Deland, it was at least 4 specialists that I saw after my first surgery that said, we can't help you, or, we're not sure what's wrong. And exactly what you said, good luck to you. And
Yeah.
then I'm back to square one. And it was through a friend of a friend that said to be tried hospital for special surgery. And at that point, I'd never heard about the place. And then when,
Yeah.
you just do a little bit of research, you're like, okay, this is where I want to go. And then, you find the Jedi Masters there that were able to
Yeah.
help. But
Yeah.
it kind of like you said, if I'm a smoker and I'm overweight, and you say, listen, we need to do your hip, but you know, in order to qualify that, and I'm sure there's a lot more to it, but in order to qualify for this lifetime warranty, we've got to get you off smoking, and we got
Yep.
to get you on some type of weight training, or exercise plan and diet plan to get the weight down. I mean, and that ultimately has that ripple effect where healthcare would be lower for everybody if we're all a little bit healthier.
Yeah, I mean, Eric, I think you're hitting upon, a larger picture conversation that is important that we oftentimes leave unfinished because each of us touches a small segment of the journey.
Yeah.
The argument is how do we get ourselves involved in the entire journey and how do we help manage that? How do we help finance that? And how do we bring and put people together to help coordinate all of that? And that's not a small challenge. And the way we finance healthcare is not necessarily conducive to that.
Hmm.
The way I think patients enter and exit our healthcare systems through insurance is not very conducive.
Hmm.
I think the insurance companies, I think, have an opportunity to help coordinate that care much better than they do, rather than providing a list of potential providers.
Yeah.
And I mean, there's a ton of areas for reform that can happen. I know a number of people are working on it,
Mhm.
but I just think that a bridges across each silo, I think, ultimately will be bring a much better solution.
Yeah, and definitely something I want to come back to in a second. I want to hear a little bit more with, so are these the type of things that you brought when you started working with the American Medical Association, some of these thoughts, or was this is a Geisinger focused thing? Did you bring that to the AMA?
No, well, I think my experience with organized medicine and kind of integrated healthcare are mutually beneficial
Hmm.
in the sense that I've been involved with the AMA for over 35 years. I have a tremendous respect for what it does. I have found some success in leadership in that way. But fundamentally, I would say that the AMA is, whether you like it or not, is the largest and most powerful voice for American physicians.
Hmm.
Now, one might say, I don't believe in this policy or I didn't do that and this and the other, but I consistently question the same people who say, I don't find value in the AMA with this question. I said, well, if the AMA wasn't here, what would your life be like?
How do
Right.
they answer? What's the rough?
Well, again, a lot of people who are negative on AMA will pick you the 5 issues that they say we disagree with. So they'll say, the AMA supported the Obamacare, right, and ruined medicine forever. Therefore, I'll never join. And they'll say something like, I don't believe in the AMA's principles around gender affirming care because I happen to be very conservative, or I don't believe in certain stances on women's health that the AMA has taken a position from.
Hmm.
And then I say, okay, well, if the AMA wasn't there, what would happen to, your current level of reimbursement? Where would your voice be when it comes to advocating for Medicare or Medicaid reform? Where would your voice be when it came to having a voice at the table on market consolidation or antitrust or physician unions, right? This is all stuff that the AMA does in the background and you benefit from and you don't even know it.
Hmm.
And my argument is simply this, is it's easy to throw stones at something that you don't believe in, but you have to recognize the complexity of our healthcare system. And further, you need to understand that not everything is going to be done within your single narrow view of how healthcare should be. So in the aggregate, if there's value, then why not support the only organization that has a seat at those tables? Because you have a voice to help influence what's being said.
Yeah, I think there's a lot of overlap there with a lot of different associations. I know some of the trade associations I'm involved in. It's having that. I love this expression you said, having a seat at the table. Because for your world, if there is no voice, then the insurance companies would probably dominate more than they currently do. Yeah. I mean,
I
it's
think that
also one of the things too where you also can't please all the people all the time. So, but it's definitely interesting.
okay.
So when you talked about your theory, your philosophy, the approach that you brought with Geisinger, how we want to really work with somebody from soup to nuts, and make sure
Yeah.
we're dealing with all of their ailments. I think that's frankly, there's a lot of overlap in what I try to do with my clients too. It's like, if they need college planning, we're help them with college planning, but they also might need estate planning and retirement planning too. And I always leave it up to them as their decision. If they don't want to engage me for those certain things, then I'm not going to. But if I'm still going to overturn all of those stones to make sure that their insurance is right, their investments are right, their retirement plan is right, because I don't ever want to have a situation where somebody comes back to me and says, "Why did you never talk to me about
Yeah. Eric, it's funny. I just reflect that, doctors, I have looking back in my own career and kind of the interactions that I've had over a long time is, I think we've established I'm a little bit of an unusual entity and as an orthopedic trauma surgeon who happens to be an attorney and all these other things. That early in my career, I found myself oftentimes giving advice or having people seek me out for advice, typically around a contract that they were looking at or
Mm,
something. And what it did is it exposed to me a lot of the things that I think medical school teaches you to be a great doctor, but they're very deficient in teaching you how to be a great professional. And so we can be the greatest clinicians and technicians, but frankly speaking, most doctors are not the greatest at managing their money. They're not the greatest at investing their time. We have a culture of saying yes to everything. So that sucks our time at the sacrifice of many personal things. We also have a culture that requires us to know everything or at least be the smartest person in the room. Because when you're in a patient room, you don't want to sit there and say, I don't know, let me get my colleague. You're
mhm,
sitting there saying, I have to be the expert. And then the third cultural aspect that doctors face is that we rarely ask for help.
mhm,
So when you take the three things combined, you actually are now entering into a workforce that is designed, right, that you are entering into the workforce that is designed almost to take advantage of all of those things. So physicians who enter into workspace, they will get a contract from a system or an employer, and their intention is to say, I need to get my best deal. So that they will go reach out to an attorney, and they'll oftentimes find that attorney through word of mouth.
mhm.
This guy did mine, that gal did mine, whatever. You have no idea if anyone's. It's like being a patient and finding a doctor. And then the attorney will inevitably turn around and say, "Oh, well, here are 5 things that I put in, and I'm going to charge you a certain amount for redlining your agreement. Good luck asking for it." In no place, way, shape, or form is there a profession out there that does what we do in medicine, that you essentially leave the client or you leave the person who is the subject matter of a negotiation to negotiate for themselves.
Hmm.
Think about this. So, in the professions, law, artists, movie stars, sports, and athletes, there's no profession out there that says, Michael Jordan, I want you to go negotiate with Bulls, and here I'm going to redline your agreement, go ask for $10 million. Good luck.
Yeah,
They have somebody who helps them,
yeah.
right? And that typically is someone whose stewardship of their careers is important. That's usually an agent, right? The same thing applies to the world of wealth or tax. I talk to doctors all the time and I say, how did you find your wealth person or your tax person? And almost inevitably, it's, my Uncle Joe sent me somebody. Or as soon as I graduated residency, I found myself making a pretty good, healthy paycheck and I needed a tax guy. And my colleague sent me one or my dad had a good one and whatever. You have no idea.
Mhm.
And so it becomes very transactional. And when you said, do you have a tax strategist? And this, I don't even know what that is.
Mm-hmm.
Right. And then you go into further things is what is it about your professional life that you would like to achieve outside of medicine, and how do you plan to get there? And you talked about it in terms of retirement and others. I'm talking about other things like, maybe one day I'd like to write a book. Maybe one day I got a screenplay. Maybe I have an idea for a patent, an intellectual property, and then it gets put in the back burner because we get busy.
Yeah.
And there's nobody helping you move those ideas along. And so I see this all the time. And I think that's where there's real opportunity in the workforce, is to bring back agency to individual physicians, to provide them with help that they don't want to ask for and they don't think they need. But most doctors who are at my stage or even later will sit there and say, I wish I had somebody.
Yeah.
Right. That could help. And I think that that's where there's opportunity. And at some point, I hope to fill some of that gap.
Well, I think one of the great points that you make there is that this is actually one of the reasons why I launched the podcast. And my financial planning practices focuses on physicians and healthcare professionals. And, I hear, Eric, we're never taught this stuff in med school. We're never, patient outcomes is what we're taught, not financial wellness. And my thought process is the more people that could come on and share their relationship. I mentioned earlier, a psychiatrist that I have as a client who's very, very smart, very, very sarcastic. So I like her even more. But when we talk about her finances, she says, Eric, do you realize, Eric, I'd rather have my eyeballs tattooed than talk about this stuff.
Right.
And so I use that line a lot, but it's so true. She's like, I just don't like talking about money. And so my thought process with the whole podcast is really the more people that hear that from their peers, really, that, hey, it's okay to not have all the answers when it comes to your finance because you were never given these tools. And it's okay to seek out help. Whether it's for me, it's great. If it's someone else that they trust, that's fine too. But, a rising tide lifts all boats kind of thing. The more people hear that it's okay to ask for help, the more people hopefully will ask for help and ultimately get the help that they need.
Right. Exactly.
Yeah. So, but yeah, I think a lot of industries are like that. Medicine is like that. You talked about, working on every aspect. Certainly in finance, we strive to do that too. But I think a lot of industries are, they focus on what necessarily puts money in their pocket, not doing the complete job.
Right. I totally agree with you.
And that's
The
hard.
thing.
That's hard. So your dad was a physician, your grandfather was a physician. How was their relationship with their finances? Were they able to help you?
It's very interesting. Yes and no, right? They kept me out of trouble, but really, I think that, getting financial thought process is a very individual sport. Right. I'm not the same surgeon as my father. I'm not the same in the same practice environment with my father. So, for example, he was an independent practice working with a lot of the world and tax that could revolve around deductions for expense. And I was a W-2 employee forever. Right. And so even fundamentally on that, I think that the approaches are a little bit different. And I think each plan has to be individualized in that way. For me, it became rather easy, but I don't know if it was any good. But it was simply go with the system's financial 4K, 401B, whatever it is, and just put it in and maximize it and set it and forget it. And for a lot of W-2 employees, that's basically the way you go, right? But it wasn't very heavy in terms of future track strategy and planning. And so I'm with your psychiatrist colleague, I think, in many ways, in the sense that, regardless of where I sit in the world of medicine and the things that I've accomplished, I'm the first one to admit that I'm probably not the one to be asking advice around management of wealth and things like that. But, with an eye toward trying to find the right people who can help you.
So where can people find out more information about you?
It's a good question.
I can make it LinkedIn. We could use LinkedIn.
Let's use LinkedIn.
Okay, we'll put the LinkedIn link below.
Yeah, that's a great idea.
So I want to thank you very much. I enjoyed our conversation. I really enjoyed the directions that we went on here, and I thank you very much for being on the show.
Thanks, Eric. Really great to be with you. Look forward to being with you again.
Yeah, I look forward to that too. And everybody, as you're watching, remember, when it comes to retirement plan and investment planning, you got to do what the Boy Scouts do. Is remember, the time to have the map is before you enter the woods. Thanks, everybody, for watching. There we go. Thank you so much.